launched it, didn't I? Action. Welcome. This is the Back at It podcast with Dr. Decompression. I'm Dr. Dudum, episode 30. I'm going backwards today. Today is going to be, why do I keep talking about spinal decompression? Why am I the authority on spinal decompression? And how did I get here? I've talked in previous episodes about my story, but I want to dive deeper into what that means. This episode number 30 is brought to you by PowerPlate, their amazing vibration 3-dimensional technology, and also Pillowise USA for their amazing pillows. They have this technology. There's 6 different types of pillows based on your neck width, your neck height, and the width of your shoulders, the position that you sleep in, and the firmness of your mattress. I use a blue pillow. Check them out. Come to the office, get measured. You can find other providers on their website that may be more local. Hey, if you want to learn more about just stuff to do at home, check out the link for my low back pain guide. We just released it. If you want to get some more information on, hey, what can I do now to start with my back, or how can I bulletproof it, etc., click the link below, check it out. Man, why do I keep talking about this decompression stuff? So my story, to recap real quick, I had a herniated disc 5 years ago at my L5-S1. It was 5 millimeters. And for me, the crappy luck that I had, which I see about 20% of the patients I see, the disc herniation was abutting or touching the exiting nerve root. Meaning it wasn't the inflammation that was touching the nerve, which can happen. It was the actual disc material physically on the nerve. So the pain's relentless. So whenever a patient comes in, or I'm talking to them on our phone consults, hey, so how's the leg pain? Okay. And they're like, it's always there. I said, oh, is it? It's just relentless, right? It won't give up. The dial turns down from an 8 out of 10 to a 3, like it goes down, but it's never gone. That most likely means you have a herniation or extrusion or some type of disc injury that's abutting the nerve. And I bring that story up. I bring it up because I know exactly what that feels like. I've had that. You know what else I've done is I've actually fixed my own back with spinal decompression. 4.5, 5 years ago, I got the table, didn't know what I was doing. Jocelyn, who's our director in the decompression department, her and I trained, got me on the table. That first pull, we talk about this a lot in our videos, like Starbucks, that first sip feeling, like that first sip of coffee you have is like amazing. And everyone wants that first pull feeling of, oh my God, I want to fix this thing, put us on the table, pull it. Well, I did that. 5 years ago, I did that. I said, hey, crank this thing up, fix this thing. It was brutal. And that's when I talked last episode about the miss is you can get hurt on the table. You can't just rush into this. You have to retrain the body. It's kind of like if you go to the gym and you've never worked out, or you haven't worked out in 10 years, and you do, let's say you get 50-pound weights and you do biceps curls. Well, if you haven't done that in a while, or never, you're gonna hurt yourself. It's common sense. Same thing with decompression. So my body didn't react well for a day or two, and to be honest, I was kind of nervous. I was nervous to get back on the table. It took me a few days, and I got back on and reformulated a program, and after 7 weeks, my back and my leg was amazing. So I've been there and I've understood the feeling of, hey, wanting to just grip it and rip it and fix it. And then also the consequences of that. And that's why the decompression program I've established has been so successful, because I fixed my own back. It's kind of like if you want to learn how to shoot basketball, you probably wouldn't go to someone that's never shot a basketball. You'd want to go to someone that knows how to shoot a basketball and, quite honestly, shoots it pretty well. Like if Steph Curry was putting on shooting clinic, you would probably want to go to that clinic versus John X that has never shot a basketball or shot the ball 10 times in his life. So started off this place, this clinic, 4.5 years ago with one table. And we just started helping more people. How did this get started? I'm answering the question that I get every day. How did you build this thing? I mean, you've got 10 spinal decompression tables. 10. We have 10 now, okay? How did this happen? Well, it happened 5 years ago because I fixed my own back with decompression. I had to. I was not going to get surgery at 34 years old. The team and I, we fixed it. And then we started helping people with other issues, with chronic degenerative disc disease. I've talked about this in other episodes where, hey, maybe chiropractic care or physical therapy or acupuncture, it's helping. People are getting results and improving. You know what though? Can we get you that much better? Can we get you 20% better than your baseline? And man, we did. And we're helping people get out of bed easier. And we're helping people go to Costco and shop around without pain. And degenerative disc disease and facet syndrome and spinal stenosis is a big one with the weakening of the legs and standing for long periods. We're helping a lot of people. And now we have 10. So we started with 1 and then we had 2 and helping more people, and 2 went to 4. More and more people, and 4 went to 6, 6 went to 7, and now we have 10. I've seen pretty much any case you can think of. I've seen it, and I've helped people with it. We just opened up a new decompression center that has all 10 tables. There's 10 tables in a big room with all of our lasers and all of our power plates and all of our rehab equipment. You know, episode 30, I'm just reflecting on the story that I had 5 years ago when I myself didn't want to have spinal surgery. And now we have 10 decompression tables to help people every day avoid spinal surgery. That's the goal of our clinic. This podcast has been a great medium for me to discuss my history with my back issues, share all the patient success stories. You know, when someone says it doesn't work, it won't work. Last episode, we talked about the 3 myths. Is it going to work? It's too much time. And this podcast has given me the medium to kind of flip that and educate everyone. We're hooking up. I'm having people fly across the country from Maine all the way to Walnut Creek, California. It's about a 6-hour flight to come get the decompression. We have patients from Europe that want to fly over here for decompression. Every day, every single day on Instagram, TikTok, Twitter, LinkedIn, all of the social platforms, I get messages and requests, hey, can you help me? Can you find someone in Texas for me? Or Nebraska for me? Or Florida for me? It's really cool to see how people are open to spinal decompression. Just try it. Just try the decompression. Every day when someone asks, why am I the authority? Why do I keep talking about it? I'm talking about it because it helped me. And I want to help everyone out there that's struggling. I'm amazed every day in my office with all the new patients that we see and all of the continuing patients that we see. I'm amazed how many people have a herniated disc or degenerative disc disease or extruded disc or stenosis or some type of low back issue that are they're suffering, and I mean bad, suffering bad, and B, they're being failed by other traditional treatments. That's why I'm using this platform as a microphone to help people, because there's nothing else out there for them, and they've tried pretty much everything. And I'm thankful for our team that's here to help everyone. And I'm Thankful for all of the patients that trust me and my expertise from fixing my own back to allow them just to go on a walk with their family, wake up out of bed without pain. Okay, just wake up without pain. Not look at a staircase or a hill or a driveway to walk up and dread walking up it. So thanks. Episode 30, I'm just grateful that my back feels better, and I'm grateful that I'm able to help so many people with a new technology with spinal decompression. Thanks to our sponsors, PowerPlate and PillowWise. And check out episode 31. We'll do more education and patient updates in episode 31. But definitely just wanted to share a new update with the new Decompression Center coming out, in our 10 tables, in our growing team, and so many patient success stories from lower back, neck, arms, neuropathy, nerve pain, so many amazing successes, and I'm so thankful to be able to change everyone's life the way that we have. So thank you for listening. Don't forget to subscribe to our channels and our podcast, and I look forward to seeing you all on episode 31. Thanks.